Have you ever woken up exhausted after a full night of sleep? Not a restless night, not a short one, a real night, 7 or 8 hours. And yet you wake up in the morning with that heavy fatigue in your limbs, that feeling that your body didn't truly recover. You blame it on age. You tell yourself it's normal, that everyone around you feels the same way past 60. And you carry on. You carry on sleeping the same way, in the same position, with the same habits you've had for decades, never wondering whether something is happening during those hours when you're not conscious. What I'm going to tell you today, a lot of people don't know. Not because it's hidden, but because nobody takes the time to talk about it clearly, without incomprehensible medical jargon. And yet, every night, thousands of people your age go through something silent, something invisible, that wears down their heart, their brain, and their arteries while they think they're simply sleeping. My name is Dr. Hillman. I'm a physician, and for more than 20 years, I've been helping patients over 60 manage their health on a daily basis. I've seen patients who came to see me for chronic fatigue, morning headaches, memory problems, blood pressure that resisted treatment, and in a number of cases that struck me for a long time, the root cause wasn't in their diet or in their daytime lifestyle. It was in their night, in what happened during the hours when they were sleeping, or thought they were sleeping. Today, I'm going to talk to you about sleep apnea syndrome. Something many people know by name, but very few truly understand in terms of its mechanisms and its consequences on the body after 60. I'm going to explain exactly what happens in your body during these episodes, why the risk increases with age, what warning signs you can recognize yourself, and what you can concretely do to protect your heart and brain during sleep. No excessive promises, no magic solution. Just solid science, explained clearly so you can make the right decisions. Let's start with an image that will help you understand what happens in your throat during an apnea. Imagine a flexible garden hose lying flat on the ground. As long as there's pressure in the hose, it stays open and water flows normally. But if you reduce the pressure, the hose collapses on itself, compresses, and the water stops flowing. That's exactly what happens in your throat during sleep. The muscles that keep your pharynx open, the airway behind your tongue, relax. In a young adult, this relaxation is partial, managed. But after 60, several changes happen simultaneously that make this mechanism much more fragile. The pharyngeal muscles progressively lose their tone with age, just like leg or arm muscles that need more maintenance to stay firm. The tissues around the airways tend to become looser, sometimes fattier, particularly in people who have gained weight around the neck over the years. And the neurological control mechanisms that regulate muscle tension during sleep become less reactive. The result? During sleep, the hose collapses. Air no longer passes through or passes poorly. That's an apnea. And if you suffer from moderate to severe sleep apnea, this can happen between 30 and 100 times per hour. I can already hear you thinking, 100 times per hour? I would have noticed if I'd woken up 100 times. And that's precisely where the danger lies. These microarousals, because that's exactly what they are, microarousals lasting only a few seconds, are generally not consciously perceived. You don't remember anything. Your partner can hear the snoring, the pauses, the sudden restart of breathing, but you think you slept normally. And it's this invisibility that makes the condition so dangerous in the long run. Here's what happens in your body every time an apnea occurs. When air stops flowing, the oxygen level in your blood drops quickly. Within seconds, your body detects this drop. Think of your body as a power plant equipped with a very sensitive alarm system. As soon as the oxygen level falls below a critical threshold, the alarm triggers. The brain sends an emergency signal. The adrenal glands release a surge of adrenaline and cortisol. The heart accelerates. Blood pressure spikes suddenly. Blood vessels contract. And all of this happens while you're sleeping. Imagine that every night, 20, 30, sometimes 100 times, someone sets off a fire alarm in your house. You run out of bed, heart pounding, then lie back down. And you repeat this all night. Your heart doesn't know it's a false alarm. It responds to each one as if it were real. And in the long run, this heart that endures these repeated shocks all night starts to wear down in a very particular way. A study published in the Journal of the American College of Cardiology in 2019 showed that people with untreated sleep apnea had a significantly higher risk of atrial fibrillation, that cardiac arrhythmia that multiplies the risk of stroke by 4 to 5 times, compared to people without sleep disorders. This is not a trivial correlation. It's a direct mechanism. The repeated pressure spikes in the cardiac atria, night after night, eventually alter the electrical structure of the heart. Researchers also found that treating apnea significantly reduced the risk of arrhythmia recurrence in patients already treated for atrial fibrillation. Let me tell you about Ferdinand. Ferdinand was 67 when his wife convinced him to come and see me. She hadn't been sleeping properly for months because of his snoring. Ferdinand himself mainly complained about feeling tired in the morning, despite what he thought was a good night, and about struggling to concentrate in the afternoon. And this was a man who had been sharp and alert all his life, a retired tradesman proud of his memory and his precision. His blood pressure had been elevated for 2 years, and despite medication, it remained difficult to control. I ordered a polysomnography, the test that records sleep in detail over a full night. Result: 42 apneas per hour. 42 times per hour, his brain sounded the alarm, his arteries tensed, his heart raced. Ferdinand remembered nothing, but his body kept the score. Here's the second mechanism I want to explain to you, and this one concerns your brain. During deep sleep, what we call slow wave sleep, your brain does something remarkable. The spaces between brain cells slightly expand, and a fluid circulating through these spaces begins to move more quickly to eliminate the metabolic waste accumulated during the day. Neuroscientists call this the glymphatic system. Think of it as your brain's overnight cleaning service. Think of the brain as a workshop that operates all day and inevitably produces shavings, sawdust, debris. At night, the cleaning crew arrives with their brooms and vacuum cleaners, so the workshop is clean by morning. If the cleaning crew is prevented from working because deep sleep is fragmented, interrupted, of poor quality, the waste begins to accumulate. Among the waste eliminated during deep sleep are 2 proteins you may have heard of, beta amyloid and tau protein, precisely those that accumulate in the brains of people with Alzheimer's disease. A study published in Nature Communications in 2019 showed that a single night of deep sleep deprivation was enough to measurably increase the concentration of beta amyloid in the brain. Just one night. Now imagine what happens when apneas fragment your deep sleep every night for years. You might be wondering whether this is really as common as I'm suggesting. The answer is yes, and probably more than you think. It's estimated that around 4 to 8% of adults suffer from clinically significant sleep apnea, and this proportion rises considerably after 60. Some studies on older populations find figures close to 20 to 30%. And the most striking figure, it's estimated that more than 80% of moderate to severe cases go undiagnosed. People snore, wake up tired, see their blood pressure rise, gradually lose mental sharpness, and they attribute all of this to normal aging, when the cause is right there, every night, silent and treatable. Now I want to explain the third mechanism, the one that directly affects your arteries. During each apnea, when you struggle to take in air again, the diaphragm and respiratory muscles exert a considerable effort against blocked airways. This creates what we call negative intrathoracic pressure. Imagine trying to suck air through a clogged straw. The abnormally low pressure in your chest pulls on the heart, stretches the cardiac walls, and suddenly increases venous return. Repeated dozens of times per night, this mechanical effect eventually alters the very structure of the left heart, promoting its thickening and increasing the risk of heart failure. Additionally, repeated episodes of oxygen desaturation trigger inflammatory processes in vessel walls. The endothelium, that thin layer of cells lining the inside of your arteries and regulating their elasticity, is particularly sensitive to these oxygen fluctuations. A study published in the European Heart Journal in 2020 showed that patients with severe apnea had significantly higher markers of vascular inflammation and a measurable reduction in endothelial function, meaning their arteries were less flexible, less reactive, more prone to the accumulation of atherosclerotic plaques. That's why Ferdinand's blood pressure resisted medication. Blood pressure medications work on specific mechanisms. They slow the heart, relax the vessels. But if the root cause of hypertension is repeated activation of the sympathetic nervous system every night, the medications can only partially compensate. It's like trying to bail out a sinking boat with a bucket while the tap is still running. After 6 months of CPAP therapy, the device that keeps the airways open with a gentle flow of air, Ferdinand's blood pressure stabilized for the first time in 2 years. His morning fatigue disappeared. His wife sleeps again. And at his last consultation, he said something that stayed with me. "Doctor, I had forgotten what it felt like to wake up looking forward to the day." Let me now talk about the warning signs you can recognize yourself. The first sign, often the most obvious for those around you, is snoring with breathing pauses. Snoring alone isn't necessarily pathological, but when it's interrupted by silences of 10, 15, 20 seconds followed by a sudden, loud restart, That's a sign worth investigating. If you sleep alone, some phone applications can record nighttime sounds and detect these patterns. The second signal is persistent morning fatigue. Not the fatigue of too short a night, the fatigue of someone who went to bed at a reasonable hour, doesn't recall waking up, and still gets up exhausted. If you need to take a nap every day not for pleasure but out of necessity, if you fall asleep easily in front of the television or on public transport, these are signals. The third signal, less well known but equally important, is nocturia. Getting up multiple times during the night to urinate. Many people think this is solely related to the prostate in men or the bladder in women. And sometimes that's the case. But in a significant number of cases, nocturia is secondary to sleep apnea. Here's why. When the heart is excessively stressed during the night because of apneas, it releases a hormone that tells the kidneys to eliminate more water. The body thinks there's too much blood volume and tries to compensate. The result? Nighttime trips to the bathroom that you attribute to the prostate when the cause may actually be in your breathing. Let me tell you about Sophia. Sophia was 62 years old, a retired French teacher, grandmother of 3 grandchildren. She had come to see me not for snoring. She slept alone since her husband's passing, but for what she described as worrying memory blanks. She was forgetting words mid-sentence. She had spent an hour trying to find her way to a street she had known for 30 years. She was scared. She had convinced herself she was developing Alzheimer's. When I received her, I noticed 2 things. She had gained 7 kilograms since retirement, mostly around the neck and chest, and she complained of headaches in the morning, almost daily. I ordered an overnight oximetry, a small finger sensor that measures blood oxygen levels during the night. The results were telling. Her oxygen level regularly dropped below 90%, with episodes reaching 84%. To help you understand what that means, a normal oxygen level is between 95 and 100%. Below 90%, we speak of desaturation. At 84%, brain cells begin to suffer from oxygen deprivation in a significant way, every night, for hours. And Sophia was wondering why her memory was failing. After diagnosis and treatment, in her case, a mandibular advancement device, a dental appliance that keeps the jaw slightly forward during sleep to open the airways, as her apnea was moderate and well suited to this solution, her morning headaches disappeared within 3 weeks. 3 months later, she sent me a message. I'm finding my words again. I'm finding myself again. Some will say that CPAP devices are uncomfortable and that many patients abandon them. That's a real problem that healthcare professionals need to take seriously. But it's important for you to know that several therapeutic solutions exist today. For mild to moderate apnea, the mandibular device is often very well tolerated. Surgery is an option in certain cases, and there are lifestyle changes that can significantly reduce the severity of apneas. Weight loss is the most effective. A study published in the New England Journal of Medicine showed that a 10% reduction in weight among obese patients with moderate apnea reduced the number of apneas per hour by approximately 26%. The mechanism is simple. Fat that accumulates around the neck and in the pharyngeal structures exerts mechanical pressure on the airways. Less cervical fat means a clearer airway. Sleep position is also an underestimated lever. Apneas are generally much more frequent when lying on the back, because the tongue and soft tissues tend to fall backward under gravity. Sleeping on your side can significantly reduce the number of apneas in people with so-called positional apnea. A simple technique: place a firm pillow behind your back to prevent yourself from rolling over during the night. Rudimentary, yes, but effective, yes as well. Evening alcohol is another factor not to be overlooked. Alcohol is a powerful muscle relaxant. Even consumed in moderate quantities in the evening, it significantly worsens the relaxation of pharyngeal muscles during sleep. If you have a glass of wine in the evening and struggle with snoring or poor sleep quality, try eliminating that evening alcohol for 2 weeks. The effect on sleep quality is often surprising. Sedatives and sleeping pills deserve attention too. Many people over 60 take benzodiazepines to sleep. These medications, by relaxing muscles and depressing respiratory centers, can significantly worsen latent sleep apnea. This isn't a reason to stop a prescribed treatment abruptly, never without talking to your doctor, but it's a reason to raise the question if you recognize yourself in the symptoms I'm describing. Finally, regular physical activity, even moderate, plays a real role. Studies have shown that aerobic exercise, Brisk walking, cycling, swimming improves the tone of pharyngeal muscles and reduces the severity of apneas, independently of weight loss. A Brazilian study published in the journal Sleep in 2011 showed that 12 weeks of moderate aerobic training significantly reduced the apnea-hypopnea index without participants losing any weight. The mechanism involves general muscle tone, autonomic nervous system regulation, and reduction of systemic inflammation. There's something I want to say that feels fundamental to me. Many patients I've seen in consultation had a common reaction. But doctor, I've always been like this, and I'm still here. And that's true. Sleep apnea isn't an immediate death sentence. People live with it for years. But the body keeps a silent ledger. Arteries thicken, the heart remodels, the brain accumulates what it couldn't clean, and sometimes the bill arrives all at once, in the form of a stroke, an atrial fibrillation, a heart failure that seems sudden but was years in the making. What I want is for you not to wait for that bill. Here is the concrete action plan I propose. In 3 steps, you can begin this week. The first step is observation. For the next 7 days, note each morning how you feel upon waking on a scale of 1 to 10, and whether you have headaches or a dry mouth when you wake up. These are indirect indicators of nighttime apneas. If you have a sleep partner, ask them to observe your breathing. If you sleep alone, a sleep tracking app or a simple audio recorder can help you detect patterns of snoring with pauses. The second step, talk to your doctor. I know many people hesitate, out of shyness, fear of seeming like a hypochondriac, lack of time during appointments. But if you recognize yourself in several of the signs I've described, persistent morning fatigue, morning headaches, frequent nighttime urination, reported snoring, blood pressure difficult to control, then these symptoms deserve investigation. Your doctor can prescribe either a simple overnight oximetry, the small finger sensor I mentioned with Sophia, or directly a polysomnography if the signs are suggestive. These tests are not invasive and generally don't require hospitalization. The third step you can start tonight. If you normally sleep on your back and snore, try sleeping on your side tonight. Use a pillow behind your back to avoid rolling over. Stop the evening alcohol if you drink any. And if you take a sleeping pill, note it down to discuss at your next medical appointment. Before I close, an important word of caution. If you recognize yourself in the severe symptoms I've described, significant desaturations, frequent and long breathing pauses, severe daytime sleepiness to the point of falling asleep while driving or during activities requiring alertness, don't postpone seeing a doctor. Self-treatment doesn't replace a proper medical assessment. Mandibular devices bought without a prescription may not be suited to your anatomy. CPAP devices require precise calibration based on your personal data. I also have a particular thought for people living with heart failure, chronic obstructive pulmonary disease, or those with a history of stroke. In these situations, sleep disorders can be more complex and often require specialized care. For Ferdinand, the decision to complete the full assessment changed his life. His blood pressure stabilized, he was able to reduce one of his medications under medical supervision, and his wife told him he'd found his old self again, calmer, more present. For Sophia, the diagnosis transformed a fear of Alzheimer's into a treatable reality. Her grandchildren say she's become lively and engaged again, able to play word games with them without stumbling. These 2 stories aren't exceptional cases. They are the cases I see regularly in my practice. People who were suffering every night without knowing it, attributing their symptoms to age, and who recovered a quality of life they thought was permanently lost. Your body at 60, at 70, at 75 has a capacity for recovery you may be underestimating. Arteries can regain flexibility, the brain can regain clarity, the heart can regain a more stable rhythm, not overnight, but genuinely, concretely when you remove what is harming it every single night. We spend on average a third of our lives sleeping, a third of our lives during which our heart beats, our arteries maintain their pressure, our brain regenerates or wears down depending on the quality of what happens during those hours. Ignoring the night means ignoring a third of your physiological life. It is never too late to understand what happens during your sleep. It is never too late to talk to a doctor about it. It is never too late to take that first step. If this video taught you something important today, if it gave a name to something you were living without understanding, subscribe to the Next Stage Health channel so you never miss an upcoming video. Every week, I come back with a concrete health topic, explained clearly, for people over 60 who want to understand their bodies and make the right decisions. And leave me a comment. Do you snore, or does someone near you snore with those telltale pauses? Simply write, "I'm concerned," or "Someone in my family is concerned." You might help someone else in the comments recognize themselves too. Take care of yourself, and take care of your nights.